uh, moving people through the system, and evidently that's what we're doing in terms of allowing them to move out early. It means that if we keep them in longer, it will also mean that we'll have a greater financial commitment, does it not?
There's no question that in order to do what I'm talking about, it's going to require some financial commitment to have additional cells. It's perhaps not as much as you might immediately think, because, of course, you do have criminals who are just on a revolving door. They're in, they're out, they're back in again, and I think it's clearly in the public's interest to just keep them in a little more. But there's no question that it would require that. It costs, in a modern, well-designed prison, it costs about $39 a day to keep someone there. But when you have violent criminals, I mean, it's a lot of money, but it's something you have to pay, and I think, frankly, the public is very willing to pay that to keep, especially violent criminals, off of the street and out of the schools.
You know, we've often connected crime with the drug problem, and indeed there is a real connection. And we're talking in terms of the statewide efforts. Now, how do you see the drug problem from a state perspective, and what could we possibly do in terms of trying to turn it around?
I think that the drug problem, you are exactly right, appears to be at the heart of a lot of these crimes that are committed. Part of it is enforcement, trying to keep drugs out of the state. That is ultimately, you have to do it, but it's not the world's most effective way to fight the problem. I personally believe that education of children as to the dangers of drugs and making them see that there are other paths and other possibilities in life, that they shouldn't get their head turned of making a little quick money in drugs or trying drugs, is something that the schools need to do, and that we can reasonably call on them to do, and ultimately will be a more effective and more humane way to deal with the problem.
And of course, you've always been concerned with the question of homelessness, and let's talk about that from a state perspective too, because I think that many of these issues, as you've indicated, cannot be solved on the local level. As a matter of fact, many of them probably require national attention more than anything.
Yeah, I would say probably in the case of homelessness that it is a national problem and a local problem. It's probably that single one is probably less of a state problem. Certainly here on the local level, you know, we've tried hard to make sure that people are at least fed and decently clothed and housed when the weather is cold anyway. And have tried hard to get some help into the hands of people who are homeless because they have substance abuse problems in particular. We have there's an organization which we have put some money into for the last couple of years called the Guest House, which is a place where police can bring people who are picked up who have, in particular, alcohol problems, and they can get some professional help rather than just being tossed in the drunk tank and then, you know, out again in a little while and homeless again.
You know, you've been throughout the state of Tennessee and doing your efforts. What have you found the majority of the attitudes to be about what's going on in the state of Tennessee when you talk to people in East Tennessee, West Tennessee, Middle Tennessee? I mean, what are some of the attitudes in reference to what the state ought to be doing?
It's interesting. This is a very big state. I'm discovering that. And there are obviously some regional differences and so on, but basically people have got a lot of the same concerns. Things I've talked about, people everywhere are concerned about jobs. I mean, there are very few people who feel so secure in their job that it's not something that's on their mind. Crime is a problem. It used to be a big city problem. It isn't anymore. It's small towns and rural areas are just as concerned as someone is in Nashville. TennCare. Healthcare for poor people in particular is on a lot of people's minds right now. There's a lot of controversy about it, and people want to talk about that. And public education always, particularly people with children, of course, in the system are very concerned about having a good public education system. That's been the window on opportunity for a lot of generations of Americans, and people want to keep it that way.
Well, what are they saying about the TennCare system? And again, why don't you...
I can't repeat that entirely.
Very good. But why don't you summarize for our viewers this morning some of your views in reference, we've got about 10 minutes, some of your views in reference to TennCare and the health area, because that is indeed one of the areas that you've got tremendous expertise. And let's talk about that for the last
Well, basically, the TennCare system, the idea of using managed care to provide care to persons who would otherwise be on Medicaid or who are indigent is basically a sound idea. It's been used in various ways in other parts of the country successfully. Arizona has a very successful program, for example. And so I guess I would start out by saying I commend the governor for picking this up. I think it's something he could have just punted on to the next administration, but he's grabbed something which is kind of a nettle and is trying to make it work. The program was implemented very quickly, and a lot of the problems it's having are really the problems associated with just trying to do everything very, very quickly. It also has probably has had less provider involvement, doctor and hospital involvement in the design of it than it should have had in retrospect. And getting that input, making sure that pharmacists and doctors and hospital administrators have their say, as well as lawyers and accountants about what it looks like, is an important next step. If I'm successful in becoming elected governor, it's an area where I really think I can help, because, as you say, a lot of my background has been in this field over the years, and I don't want to be remembered solely as the governor who took a screwdriver to the TennCare system, but I think I can help and make sure that it turns into a program which can be a model for the rest of the country. I
think that would be one of the greatest contributions that anybody could make if indeed we can work out some kind of system for health in this country, and I think that if you can be remembered for that, that is one of the great contributions. But in addition to that, I think people have also indicated welfare as being connected with the healthcare system. And how do you see that connection? And what do you think about the welfare system? And what can we do in the state of Tennessee, perhaps, to provide better services and at least to diminish the number of people who are part of the welfare system?
Well, I think the welfare system is really almost two systems. There's the system which is a safety net for people who are on it for a short period of time because of something, often a family breaking up, a husband leaving home or something like that, who use it for a while as a safety net and then are back in the job market. For them, the system works pretty well as it is. The tougher problem are, unfortunately, we have larger and larger numbers of people who have just become almost professionally involved in the system.